The knowledge base of what we do in medicine needs to have advanced to the point where you understand what a cell secretes, how cells communicate, and what growth factors are, and what an exosome is, and the different types of stem cells. The medical industry as a whole, and in particular, I think big pharma, realized very early on that cell therapy was the way the human body works, and they had to get ahead of the narrative before the science of using your cells to help you heal got kind of out of control. Hey everyone, welcome to this week's episode of the Zero Downside. Just an interesting anecdote before we really get started on the episode, because the question is always, what are we going to talk about this week? And surprisingly to me, because my daughter proposed this episode idea, and at first I was fairly resistant to it because I feel like we've covered it and everyone kind of knows how I feel about it, I thought. But again, every time we talk about something, I kind of go on a deep dive through the literature just to make sure, like, what's the history of what we're talking about, and to know if there's anything different being looked at dealing with the technology or the diagnoses or the treatment protocols that we're going to talk about. So one of my best friends and a long-term patient, and taking care of him and his whole family, is at the clinic this morning. And as I'm going through to print some stuff off, obviously, he says, "Hey man, what are you guys going to talk about today?" I said, I think we're going to look at IV therapy and IV treatment with vitamin C. And he's like, "Oh, dude, you're just getting ahead. Why do you want more black cars in your life again?" He said, especially now he goes, "You're getting ready to open up at your clinic in the Caribbean. Like, you guys are just getting ready to open up. And why would you do this to yourself?" And all I could think is, man, that's a great question. But I think the answer is because I think it's so important. And when the importance of an education about a topic that it seems like everyone should already know is being artificially censored and made to look unscientific, I think this needs to be a resource for patients that are seeking alternative care and also want alternative care based on science, not based on pharmacologic inducement, not based on the narrative being controlled to mainstream positions, not being based on the control of Western healthcare and large hospital systems, which when you go through the literature, it's almost disheartening to see how artificial some of the reporting against alternative medicine, which is what they call high-dose IV therapy. I don't know when that became alternative medicine to do high-dose IV therapy, because I found great scientifically published medical-directed science articles going all the way back to the 30s when it was being used to treat polio, right? So, and that's not my opinion. Again, this episode is not going to be based on my opinions or us treating specific diagnoses in the clinic with Absorbate. We don't agree with the treatment of specific diagnoses with high-dose vitamin C, because that would put our clinic at risk. And just so you know, we have to have a full-time practitioner, a doctor, in the clinic when you do IV vitamin C. If you do high-dose vitamin C, which there's a lot of IV clinics around that operate without a physician there but have a physician director, but they're not doing high-dose Absorbate. They're doing doses less than 10 grams, which is not considered a high-dose vitamin C IV. So when you're getting IV therapy, if you feel like you're getting high dose IV vitamin C and there's not a physician there signing a piece of paper that literally says we're not treating cancer. And the reason that's important is because it's against the law to treat cancer with high dose vitamin C, because the FDA said it is against the law to treat cancer with high dose vitamin C. A lot of the articles in front of me that we're going to kind of rush through a little bit of the highlights are published on the cancer studies that have been performed with the use of high dose absorbic acid as part of different protocols. And we're going to go through some of what's been published, and I'm just going to read some sentences in scientific literature. But what we do in the clinic with high-dose vitamin C, and the reason I think that this is such an important topic, and we overlook it a lot because it's one of those things that I just kind of, I guess, over the last several years, I guess I kind of just assumed that most people know this. It's been kind of a bellwether treatment in our clinics for more than a decade. I think it's incredibly important. I think that one of the books I've recommended probably to hundreds and hundreds of patients, which actually I have it in our shelf here. I'm going to show it to you real quick. I know they're going to hate me getting up like that, but this book was published in 1961 by a Russian scientist named Emanuel Cheraskin. You can find it on Amazon. This is a copy that's been beat up a little bit. It still has the old library stamp on it, but probably my favorite edition that I have. I've had many because I continue to give them away to people over the years. But the vitamin C connection, which is called Getting Well and Staying Well. And the subtitle is Treating Everything from Cancer to the Common Cold. I think that we would never say we're treating cancer with high-dose vitamin C. That's in the title of a book published many, many years ago. The Russian scientist who, this is, again, before pharmacokinetics could even be done. So the science of the breakdown and absorption of a lot of pharmacologic treatments or vitamins, nutrients, drugs started with what's called cytochrome P450. I was in medical school. That was revolutionary. That was in the 80s and 90s. So now that book written in 1961, he didn't have access to the way vitamin C would be metabolized or pharmacologically absorbed in the cells. And so he theorized about how it was done, and he was less than 10, 20% off. Pretty brilliant, right? But he presented a lot of evidence and a lot of research to talk about the use of high-dose vitamin C treating chronically ill patients, and a lot of his patients had cancer that he had treated with high-dose vitamin C, and they saw significant results. That's not my opinion. That's just what's in that book. That's my review of that book. And I think that that book is a critical starting point in the medical knowledge base if you're going to think about alternative medicine. Now, that being the case, and already being challenged this morning by one of my best friends and one of our long-term patients to maybe not talk about this. I think that in our clinic, especially, I don't know what happened a few years ago, or what still feels like people are trying to keep us tapped into what happened a few years ago, but chronic viral illnesses and acute exacerbations of chronic illnesses, especially with the flu, has been widely acknowledged for quite some time that vitamin C in high doses, IV, makes a dramatic difference in how your body can handle viral loads. Because the viral load or the cytokines from the inflammatory response cause oxidative stress. Oxidative stress is what causes damage to the tissue. It's what causes the pneumonia component. It's what causes you to feel bad. Oxidative stress can be relieved with a high-dose antioxidant, which is absorbic acid or vitamin C, especially if given in the right forms and in the right doses and parenteral, meaning IV. there's a dramatic difference in the overall metabolic effect of the antioxidant component of absorbate. It's been widely used to treat viral illness patients for a long time and is not controversial to say there are many papers published that if someone has experienced acute viral illnesses or overload of a virus, that high-dose absorbate has been used to treat those patients with dramatic results. And that's not my opinion. It's what's published in the literature, and I think that's a pretty easy search. What gets a little bit more controversial and way less controversial in some of the literature when you go through the scientific literature. And again, we're going to go through some papers that talk about the difference between in vitro and in vivo. In vitro means in the lab. In vivo means in an animal subject or in life subject. There's not a lot that has bad in vitro data that should ever be turned into an in vivo study. If it didn't work in the lab, why would you try it out in a live subject? The converse is not true. I think that if something works in vitro, it's worthy of in vivo studies. That makes sense, right? So if it doesn't work in the lab, don't try it in a human or an animal subject. But if it does work in the lab and it looks like you have a really good scientific explanation, so again, this is what we say all the time. I don't need 50 white papers. I don't need 50 randomized controlled studies over the last 50 years. What I need is a physiologic, scientific explanation for why and how something would work. If that exists, that is in vitro data. Means that physiologically, this is how the body would work. We understand cellular metabolism. We understand intercellular glutathione levels. We understand the oxidative reaction in the chain with high-dose absorbate. If we have good physiologic representation of the science, then let us take that and turn it into in vivo studies or in vivo use. So the first thing that we look at when I'm proposing treatment is what is the, oh my God, here's your first shot of the drinking game, right? Is what we look at as the potential downside. So the downside of absorbate is really well published as being about the same in all these studies as the placebo. And I'm going to specifically quote the studies that say that. So again, that's not my opinion. That's published data, and we're gonna refer to that because there's a couple of these really large review studies that were written by mainstream physician who literally called the treatment group. They first of all, they talk about how surprised they were in the amount of patients, and they were going from 06 and 08 in these big surveys. They were shocked and surprised in their own words by how many, and they literally call it CAM physicians, meaning alternative medicine practitioners. And so they call them complementary and alternative medicine practitioners, or CAM doctors, which I didn't know I was a CAM doctor. I didn't know that a vitamin could make me a CAM doctor. Of all the things we do, you would think vitamin C IV is the least controversial thing in the world to label me an alternative medicine practitioner as a fellowship-trained orthopedic trauma surgeon. I don't know how in a trauma fellowship I became an alternative medicine doctor, and I'll tell you that I don't mind that term now because I don't mind being alternative to a system I think is broken. Alternative means a choice, right? So sometimes alternative just means I'm giving people another choice in the narrative outside of mainstream medicine. I took offense to that because I think I am pretty mainstream in most of my points of view. I think I'm remarkably similar to most of the people in my life on overall core values. I don't know that that's true if you compare me to the medical establishment of employee physicians and pharma-derived medical treatment plans. So I don't mind being called alternative now. I'm not as offended by it because the study that I'm going to reference from the late 2000s, not 20 years ago, literally labeled everyone that was using IV vitamin C in their clinic as an alternative medicine practitioner. And they talk about how mainstream doctors, I love the wording. I'm going to go through some of those sentences because it literally provided me the motivation to do a lot of the search I went on. It was one of the first articles I found doing a little bit of a deep dive was I want to look for review articles on the topic first. I find this one, and the wording of it, without using, because I can't put any dollars in the cuss jar with this episode for sure, and my 11-year-old is directly in control of that jar. So I think it upset me. How about that? So it made me uncomfortable to see how much of the narrative is really against what we do and how hard they've worked to label it as ineffective or risky. When I was looking for side effect data on it and couldn't hardly find it, right? Like I used to make fun of high-dose vitamin C in medicine because I thought, oh, oxalate neuropathy and kidney stones and renal failure. You know what? Would I treat someone in renal failure with high-dose vitamin C? No. Would I treat someone with G6PD deficiency with high-dose vitamin C? No. It's a $20 lab test to know that you have G6PD. If you don't have G6PD, you can't metabolize high doses of absorbate. You can get a problem where you metabolize red blood cells called hemolysis, and that side effect is published. The incidence of G6PD deficiency in the Western Hemisphere is really, really low. We've been testing everyone for G6PD for a decade. I think we've had 2 people ever be deficient in G6PD, and so they can't get doses greater than 10 grams. And under 10 grams, I still thought was a risk, but not in the literature. So if you have a G6PD deficiency, you could still get 10 grams of IV vitamin C, and it'd be relatively safe compared to, in all these studies, it was safe compared to the placebo. Actually, the risk of an adverse reaction in high-dose absorbate patients was the same as the placebo-controlled in all the double-blind studies that some of these review articles go through. That even surprised me a little bit because I thought for sure with how strong the narrative is against vitamin C IV, and I'll tell you, let me give you one example of that. When we first started doing that, we could get a 50-gram vial of absorbate powder to reconstitute into vitamin C to be delivered IV for $20. And we had 10 different compounding sources available in the US for our clinic. Now, fast forward 2024, how many compounding sources do we have available to get absorbate powder in a 50-gram dose? 3. Why only 3? Because the FDA has closed the others because they said they were illegally selling high-dose vitamin C to clinics that were treating cancer patients. I didn't know that we were treating IV vitamin C and closing clinics down in the middle of a fentanyl crisis. Like, it's fine to come across the southern border with fentanyl and the fact that everyone knows someone now that's died of an overdose, and now that they're checking out narco pens to you on airplanes and in drug clinics. That's not this huge the FDA's not going to really get involved in a lot of that other than make it really difficult for your physician to treat your pain anymore. But we're going to close down compounders making IV vitamin C powder because that is potentially harmful to the population. Nope, that's not what they said. Did it kill anyone? Nope, that's not what they said. Did it give everyone oxalate neuropathy? No, actually it's incredibly rare. Not only is it incredibly rare, unless you have kidney failure or a big history of kidney stones, it's not even really a thing, according to the scientific literature, right? After a deep review and a 28-year private medical practice, these are where these things come from. This is facts derived from the medical literature, and if it's my opinion, I'll say it's my opinion. But I thought that there had to be more danger to it for the narrative against it. I have failed to find that. And in the biggest review articles, going through thousands and thousands of patients treated, that doesn't exist as an overwhelming cause or side effect that's been published. The side effects are relatively minor. The side effect is maybe a little bit of fatigue. The most common diagnoses that were treated with IV vitamin C by alternative medical practitioners, I won't go into because it's against the law to say you're treating those diagnoses with IV vitamin C. I think that the patient that receives nutritional IVs in our clinic are patients that receive glutathione, which I think is incredible as far as its antioxidant and oxidative reliever of oxidative stress and cellular damage. I think that glutathione is in the same category as vitamin C as an antioxidant. I think in high doses of IV vitamin C, it becomes more of a there's a much more integral oxidative, non-oxidative, antioxidant component to it, and we can go over some of that. But I think that overall, think of them as antioxidants. There is measurable levels of glutathione in most cells in the human body. And I think that to overlook a peptide, again, glutathione is a peptide, to overlook a peptide that has such significant power to relieve oxidative stress, I think would be a mistake because it's incredibly easy to deliver. There are some liposomal oral forms now that have shown to have decent delivery. I do think the administration of IV glutathione has dramatically changed a lot of the way a lot of people feel and react to chronic disease. And that is not just anecdotal, that's in a bunch of published papers. Now, in our clinic, IV glutathione or a glute push is part of IV therapy that I think is integral. An IV with high dose absorbate, I think can provide dramatic oxidative protection against cytokine-induced inflammatory illnesses or the cytokine-induced symptom of whatever illness or thing you're struggling with. Sometimes what you're struggling with is just life, just cortisol levels, just stress. And the oxidative cytokine parts of stress and the oxidative stress-induced, it can be fairly dramatic and can be fairly easily resolved by giving your body better resources, which is helping build up your absorbate levels in your liver. Like some of the first scientific research ever done on vitamin C was in the 1760s. And it was done by a British captain who was trying to see how to treat scurvy in sailors. And so guess what was the best source of acids, absorbic acid, to treat scurvy? It was citrus fruits. And he published that in 1762. So if you have scurvy, which is the only going back to 1762, the only FDA-approved diagnosis that you treat with vitamin C is scurvy. In 300 years, that's how far the FDA's come. They've elevated their level of care to we're going to approve something that was proven in 1762 to make a difference, right? So, I mean, come on. Now, if it treats scurvy and the oxidative stress associated with that, what else can vitamin C be important in? Again, we're the only mammals outside of fruit bats, guinea pigs, and great apes that don't synthesize your own absorbate. I think that there may have been a time in the human history where our liver may have been able to synthesize its own absorbate. But because the liver, later as the development of society happened, we developed other toxins that our liver had some more important functions to do, and with them, alcohol, heavy metals, environmental stuff. I think that at some point, your body has to make decisions. And because The only other mammals that can't synthesize absorbate are animals that have really diets that are really high in absorbate: guinea pigs, fruit bats, great apes. Again, every other mammal, sheep, horses, cows, they don't get scurvy coming across the Atlantic. Humans do, because animals can synthesize absorbate in the liver. So we have to have absorbate in an outside source. The problem, taking enough of that oral to take care of that, is oral absorption and conversion in the liver and being able to store is incredibly difficult because there's some GI toxicity. So the average human can take somewhere between 4 to 7 grams a day without getting diarrhea. So there are some studies in some of the older guys that would have colds and stuff, and they'd put a gram out and take a gram an hour until they got diarrhea or until they didn't feel sick anymore. Anecdotal, those are all the stories from med school, but that's not the most scientific way to do anything, right? There's great data, and actually there's one study that showed, so if you've heard of why vitamin C, don't take vitamin C if you have cancer, it was because it limited the efficacy of your chemotherapy. And because Mayo Clinic did a big study that showed IV vitamin C didn't affect any of their cancer studies. There was no benefits in their cancer patients. The Mayo Clinic studies that are referenced in this review article used oral vitamin C before pharmacokinetics existed. And what they did know is oral doses of vitamin C, even at the high levels they were treating it, didn't really have a plasma level associated with the active metabolites of vitamin C. So if you were going to say that it didn't work, you need to show that you were able to give enough to matter. In the IV data in those studies, it at a cellular level has 25 times higher metabolite plasma levels of concentration of vitamin C. So oral probably is not the same as IV if you have cancer. It's not my opinion. I'm just going through the scientific literature, but there's a great paper to show that it almost looks like, to make that statement, that they kind of tilted the data in a pseudo-scientific way to make it look like it didn't help. That is my opinion, because I think anytime you're trying to compare oral doses or really diminished doses to what we would consider high dose, which in most of these studies were between 25 and 100 grams, not milligrams, grams, I think it's very difficult to compare anything orally to that if you're trying to talk about cancer treatment. In one of these papers, and I'll go through the exact wording because I think it's fascinating, they did a rat study. And again, I love it when whoever I agree with, and if I try to quote a rat study, they're, oh my God, it's a rat study. Okay. But when they quote a rat study, it's an in vivo live animal subject. Okay. All right. So when you quote a rat study, it's not a rat study. It's an in vivo animal study. Okay. In your study, they used dihydroabsorbate, which does not exist in nature in any cell in the human body. It's not an active metabolite that we can produce. It's not an active metabolite that we've ever given anyone, and it's not an active metabolite that any CAM physician, as defined by that study, had ever given anyone. In that study in rats, it interfered with the chemotherapy drug. That is the one study that I have found that they are hanging their hat on to say that IV vitamin C gets in the way of chemotherapeutics from cancer. It's a rat study in a non-naturally existing form of vitamin C, not L-absorbate or absorbate, a form that I'd never heard of until I read it in this study because we've never used it. It's not commercially available. I can't get it through a compounder. But that's the form that was given to rats, and it altered the chemotherapeutic response to some of the chemotherapy. The alternative to that, published in the same paper, is in no study with all the different forms of chemotherapy available at the time, looking across a multitude of thousands of patients in 18 different clinical studies, did the absorbate interfere with the chemotherapeutics. And in fact, the tumor mass, the overall quality of life score, the tumor mass was affected positively. It was found to be beneficial, the high-dose vitamin C, in those studies. Again, not my opinion. We're going to have great difficulty keeping this episode up, but not my opinion. But what's published is that the cancer masses, there was a beneficial effect on removal of the tumor with the addition of IV vitamin C to the chemotherapeutic regime. While at the same time, in all chemotherapy regimes that were studied, if you added IV vitamin C, the quality of life score for the patient was significantly increased, meaning that people tolerated the chemotherapy better, had less overall side effects of nausea, fatigue. That sense of wellness was dramatically improved in patients on IV Absorbate compared to patients that weren't. It seems like if I'm going through chemotherapy and if the establishment really cares about you, wouldn't they do something that made your quality of life score go up while they're killing you with chemotherapeutics or while you're dying of cancer? Let's take that. Let's give them the benefit of the doubt. Let's say that the chemotherapy is going to work, and I can give it to you, but it's going to make you depressed, sad, suicidal, fatigued, and nauseous. There's something I could give you that has the same complication and side effect as the placebos in all of our trials, that is going to make you not have all those same side effects. You're going to feel better. You're going to feel a sense of wellness. You're going to feel senses of well-being. You're going to have less nausea, less headaches, less overall fatigue, and your quality of life, meaning your score on are you happy or depressed or not, is significantly better. P-value to 0.0001, right? So dramatic, a statistically significant difference, right? And we're going to make that against a lot of give you. And against a lot of really talk about. That, for me, is a little bit of a hurdle that should show that maybe there's some other reason they don't want you to take high-dose vitamin C. And I'm not going to postulate on what that reason would be, because I think that we talk about ivermectin all the time in the same way, because there was a huge narrative against ivermectin. It's a horse drug. Don't take horse paste. It's, oh my God, we have a president telling people to drink, stuff from their aquarium. Like, no, right? Ivermectin, the people that designed ivermectin won the Nobel Prize by the World Health Organization prior to the recent narrative against things. It was the third most important drug ever developed. Aspirin and penicillin and ivermectin. Because it's one of the only safe antiparasitics and antivirals that have been administered. It was really inexpensive, it's generic, and its safety profile is insanely good. Meaning that we had been giving, in the world, billions of doses of ivermectin have been taken to prevent dengue river fever, to treat amoebiasis, to treat many chronic malaria, to treat many chronic and acute viral illnesses that killed people. And with ivermectin, they resolved. It became used as a dewormer and horse medicine, but it didn't start as that. There are a lot of human medicines that are used on other animals because it's in vivo. It's an animal study. So if it's safe in the lab and it's safe in humans, wow, can I use this on my dog? Like tramadol, vitamin. The antibiotics that you give your dog when they're sick are no different than the antibiotics you take, right? So don't label something as a horse drug to put a narrative against it. Maybe the veterinarians of the world and veterinary medicine that wasn't as driven by big pharma at the time, and now I think it maybe is, maybe they were a little bit more intuitive than Western medicine was allowed to be. So I think that the narrative against ivermectin made me look a lot more at ivermectin data. And if you go back and look at a lot of the ivermectin data, you're going to find some really scary things if you have a really expensive drug to treat certain abnormal illnesses, and there's a really cheap generic drug that was published 2 decades ago to treat those illnesses, you might not want people to know about. So they kind of had to smear the reputation of ivermectin to keep people from looking at it for COVID. I understand why you would not want to treat people and keep them alive and make them less sick and give them something with no side effect, but they did. Right? I mean, that's pretty well documented. And now they're trying to unwind all that, right? Like ivermectin is safe. We never said not to take ivermectin. We said that even the makers of ivermectin have came out and said, no, the makers of ivermectin are covering their own political butt by saying we never recommended it for COVID. They're not saying it never worked. No one said it didn't work. And oh, by the way, there's great literatures and research now to show it made a dramatic difference for a lot of people. So let's just say it that way. I've never said it cured anything, but I certainly can look at the clinical data and the literature and know it was a great treatment for people that were sick and didn't have any other treatments available. In the same way as high-dose IV vitamin C and D3 would have been, and is, because those studies are published too. I think a lot of the relook at vitamin C came about during So now that we're going to get past me and our experience in the clinic with high-dose vitamin C, let's just go through a little bit of the publications because these are all peer-reviewed journals. And what I want is to stimulate people, especially if you hate everything I'm saying and you disagree, you're welcome to that. I think that you need to, you're reading probably, you know what most people tend to do? I think most people tend to only read stuff that agrees with how they feel. And I think that we don't like incongruity. And when there's something that's incongruent in you, I think God did a really amazing job at designing this because our brain, we talked about this in my clinic yesterday with one of our employees who says she tries to be happy, but there's sometimes she gets in her head. I said, okay, you know what Tony Robbins would say about that? He said, talk about adopting a power pose, like change your state. You know, sometimes if you're unhappy, smile at people because your body will have a real hard time with incongruence between what you're doing on the outside and how it feels on the inside. And it's more likely that your sadness inside will display with outwardly, like you slump your shoulders. But if you smile and stand up straight, it's really, it will trick your physiology of your body habitus, your stance will influence your emotional state. So physiology can, because our body doesn't like things that's incongruent. Our mind doesn't like things that are incongruent. You can't feel one way and act another. So if you act one way, your body will convince yourself that you feel that way too. And I think that you can turn things around that way. And so I think it's natural. So I don't think there's anything wrong, but I think that there are times where, especially when your way doesn't work, like if the way you think and if everything you read agrees with you, you need to step out a little bit, right? Go on Google Scholar, or if you have PubMed attachments, I'm guessing most people don't have access to PubMed. But if you have a university student, they do. So if you have a college student in your house and they can log in through a college account, you can get to anything I get to. If you go to Google Scholar, you can get to most of what we get to. You're not going to find it with most Western media approaches, like Google, Bing, and Yahoo are probably not going to give you a lot of the topics we're talking about when 90% of their ad revenue comes from Big Pharma. You're going to get the narrative that the people paying them want you to get. So you're not getting a really host native search. And I had to prove that to an attorney one time while we were in mediation, just with the word stem cell. He goes, oh, wait, you know. And so I said, okay, so look this up on DuckDuckGo, an article I'd published, and look it up on Google. On DuckDuckGo, it shows right up, even if you don't spell all the words right. On Google, if you put the commas in the right place, it was page 5. Probably not operating on the same algorithm. Just theoretically, I would think, right? Not to get in trouble. So if you really want to challenge the narrative, search some of these up. Like look up IV vitamin C to treat and put your word in. Or look up safety of IV vitamin C. And don't do it. Actually do it. Do it on Google Bing and Yahoo, and then do it on Google Scholar. Tell me if you're impressed by the difference in what you see on the first 2 pages. Everything below sponsored, right? Tell me what you see, and I think that I'm gonna welcome you into the dark side of alternative medicine. Right? So, because every time I do that, I become more and more convinced that it's, you know, they say you're paranoid but you're not paranoid when they really are out to get you, right? So I think that let's take a look at some things that might be considered hardcore science data. This is one of my favorite recent papers. You know, a lot of the data search goes back years and years and years, but in 2021, and something was going on in 2021 that made a lot of people start looking at absorbate again, because we've talked about the efficacy of vitamin C in treatment of viral illnesses, and there was a significant problem with a viral illness starting in around 2020. I love the first sentence of the abstract. Mounting evidence, and again, I'm just reading from the Journal of Experimental and Clinical Cancer Research, right? A really hardcore peer-reviewed journal. And the Journal of Experimental and Clinical Cancer Research says, in high-dose intravenous vitamin C, a promising multi-targeting agent in the treatment of cancer. Ooh. I would never say that IV vitamin C treats cancer, because they've closed your clinic down for that, and they've closed multiple compounders down for even selling the clinics that treated that. But it's interesting in the scientific literature to go through a clinical trial to look at it, because apparently the first word of the abstract is mounting evidence indicates that vitamin C has the potential to be a potent anti-cancer agent when administered IV and in high doses. Guess what? It didn't make much of a difference when it wasn't administered IV or in high doses. And most of the studies that it goes back to and talks about go back to, I don't know, a guy named Linus Pauling, who won a couple Nobel Prizes talking about vitamin C. We're not going to go through a lot of that article. It's well worth the read if I had a disease that I wasn't being allowed great treatment for, or I wasn't responding to the treatment that they were administering. Here's a journal from the Anti-Cancer Research, is literally the name of the journal, March of 2009. And so in 2021, it says mounting evidence. In 2009, it was emerging evidence. The narrative hasn't changed, and it's been more than a decade. So if Western medicine publishes the article, it's, wow, there's some emerging evidence. Was it emerging evidence in 2009? Was it emerging evidence in 1762? Or is it emerging evidence in 2021? Eventually you got to be responsible for what's been already out there and published, and you should know it before you think you're inventing something for the first time. So if you're just talking about a promising multi-targeting agent, and it's only promising because they're not agreeing with it, that's 2021. In 2009, which you would think if you're going to publish in the Journal of Experimental and Clinical Cancer Research, one of the journals you probably read is the Anti-Cancer Research. I mean, I have a pretty big subset of journals I feel responsible to read that all have the word orthopedic or stem cell or surgery in them. So if there was a journal, if I was doing cancer research and there was a journal called Cancer Research, I would probably want to hold whoever's treating my cancer responsible for reading at least that journal. That seems to me reasonable, right? You can't be responsible for everything that someone's ever thought or published, but there's certain probably subset of knowledge you should hold your practitioner accountable to know. Vitamin C has a controversial history in cancer treatment. This is 2009. Emerging evidence indicates that absorbate in cancer treatment deserves re-examination. A research results concerning absorbate pharmacokinetics. Remember, pharmacokinetics didn't really exist when the book I showed earlier by Emanuel Taraskin was published, and he theorized and treated thousands of patients. Vitamin C has been well documented to reduce incidence of most malignancies in humans. What? I can't believe this article just came out and said that. Like, that seems like it would be controversial. And they're referencing a paper. So that goes back to their first reference. Vitamin C, absorbate, and absorbic acid has been well documented to reduce the incidence of most malignancies in humans. What has been hotly debated is whether vitamin C has any therapeutic effect in the treatment of cancer. Wait a minute. It reduces the incidence of most malignancies in humans, and that is from the American Journal of Clinical Nutrition in 1991. Epidemiologic evidence regarding vitamin C in cancer. That was published in 1991 in the American Journal of Clinical Nutrition, and it's cited in the Cancer Journal 30 years later as emerging. 30 years, it's emerging. The journal right underneath that, 1976, supplemental absorbate in the supportive treatment of cancer, prolongation of survival times in terminal human cancer. That was published in 1976. I can see why you would need to make this against the law. If it was published in 1976 as making a difference in the prolongation and survival times in terminal human cancer, and we're just now in 2021 talking about mounting evidence, how long does it have to mount? Right? I mean, I get just as irritated at a lot of surgeons who, in my experience, and that means 2, I'm out, right? Time after time after time means 3. Like, that's not a study, that's not years of clinical experience. But if you're citing articles from 1991 and 1976 and 1978 and 1982 talking about how there was no prolongation of survival times of terminal cancer patients by administration of large doses of absorbate, International Journal of Vitamin Nutrition and Research Supplement, 1982. Like, okay, I'm going to go through this paper real quick because I'm going to try to stay a little focused. It goes through a lot of the historical background and the treatment of vitamin C. I think this is the paper that does it. I want to get to the rat study that showed why you can't take IV vitamin C with your cancer treatment. The high-dose intravenous L-absorbate in pain therapy. Wow, so published in 2024. So let's say that newer clinical literature means more than old clinical literature. Let's pretend that's a fact, because it may not be a fact, but let's pretend it's a fact that if it's newer, it's better. 2024, 14 articles in a review, the supporting evidence for the efficacy of absorbate treatment in inflammatory pain conditions, in complex regional pain syndrome, post-zoster neuralgia, neuropathic pain, and post-operative pain conditions, and in tumor-related pain is significant, and there is supporting evidence for the efficacy of absorbic treatment in these conditions. Oxidative stress is present in almost all pain conditions. Because there's no good oral form, it can't get cellular levels available. IV, L-Absorbate IV is effective, safe, and economically favorable integrative treatment option for various pain conditions, addressing the root cause of tissue damage and inflammatory-mediated bursts. That sounds like if I had a chronic painful viral condition, like herpes zoster is a virus, right? Or if I had neuropathy, or if I had tumor-related pain, or if I had complex regional pain syndrome, because you know what Western medicine has for you if you have that? Nothing. It sounds like to me that an IV of vitamin C, according to the Journal of Pain Management, might be pain and therapy, June of 24. It sounds like that would be an option for me. I mean, kind of cool, right? Okay, here we go. We're going to try to get quicker because I'm already past my time. Vitamin C intravenous use for this is the one. This is where I became a CAM, right? I didn't know I was a CAM. IV vitamin C for complementary and alternative medicine practitioners and adverse effects, published in the Journal of PLOS 1, published online, PLOS 1, 2010. Talks about survey of CAM practitioners from 2006, 2008. The thing that the reason I liked this article, and it was written by people that didn't agree with or like the use of IV vitamin C because they start trying to cite all these complications and risks until they went through all the data and found out, and I'm just going to go through some of my notes on their paper real quick. Number one, this is a huge review study. They're talking about over 700,000 doses of Absorbate, 750 to 855,000 vials, right? So we're clinically significant. If you're going to give something 1 million times, I would think clinically significant. Their conclusion, high-dose vitamin C is unexpectedly, so again, this is published in 2010. So what these guys didn't know, because they're Western medicine practitioners, is there's a whole lot of physicians out there using IV vitamin C. They were shocked. In their own words, high-dose vitamin C is in unexpectedly wide use by CAM practitioners, complementary and alternative medicine. Other than known complications of IV therapy with renal impairment or G6PD deficiency, high-dose vitamin C appears to be remarkably safe. They're shocked by that. Among the most enduring of alternative medical treatments, and this is where their bias is, right? Among the most enduring of alternative medical treatments is vitamin C. It's also one of the most popular. In 2007, it is a widely sold single vitamin with doses of over $884 million sold in the U.S. Vitamin C has been used by non-mainstream physicians orally and parenterally for more than 60 years as a therapeutic agent. So vitamin C is used by non-mainstream physicians. In one of the most controversial applications, gram doses of vitamin C were promoted by two-time Nobel Prize laureate Linus Pauling as a cancer treatment agent. I did not just endorse it for the treatment of cancer, but two-time Nobel laureate Linus Pauling did. And they reference his papers here. Then it says, complementary and alternative medical practitioners, so I guess I'm that, have been using it to treat diverse conditions, including infections, autoimmune illnesses, cancer, and illnesses of uncertain origin. We don't use vitamin C in our clinic to treat illnesses. We use vitamin C in our clinic to augment your immune function and help provide relief from oxidative stress, because that's its indication in the U.S., and I'm a big fan of helping you avoid oxidative stress that can result in pain, immune dysfunction, and problems with other illnesses. I love this. Despite its purported popularity, the extent, and again, 2010, 14 years ago, despite its purported, like it didn't even say popularity, purported popularity, like we hear these people talking about it. We don't agree with it because we're Western medicine doctors. We're all real doctors. The guys giving this are not real doctors. They're CAM doctors. Okay, same medical schools, by the way. Despite its purported popularity, despite these quacks using it, the extent of the use of IV vitamin C is unknown. Its use in CAM has not been well publicized by practitioners and their patients and is likely to be unrecognized by mainstream physicians. You know why it's not well publicized by practitioners and other patients? The same reason you're going to have trouble watching this episode, because no one wants you to know, and no one wants to get in trouble for doing it. So we don't talk about it, which is what I was told before I walked in today. Don't talk about it. Wade, man, stick to your guns. You're so close. When someone tells you not to talk about it, it almost makes me know that God's trying to let me know this is important, right? So my next sentence is the favorite one. Benefits, if any. If I look at you and say, well, the benefits, if any of that, it means I don't really like that or support it, right? Like, I don't even think you're hiding your narrative, and you wrote a 64-page paper published in a medical journal. Benefits, if any, and especially the side effects of such use, have been unreported and have been unreported or underreported. It is useful to know if high-dose vitamin C is widely used, and if so, and for what, so that conventional physicians can improve patient care by identifying any ill effects or drug interactions. So we need to really look at all these guys out there writing vitamin C, because us good doctors need to be able to help patients identify all the things that can happen to you when you do it. The rest of that sentence is, and potentially reporting any benefit. So reporting benefit, if any. So they use benefit, if any, twice. It's benefit, if any, and especially the side effects of such use. And then they end the last sentence of the same paragraph with identifying any ill effects or drug interactions and reporting benefits, if any. So they've literally connected if any to the word benefits twice in a paragraph. Anyone that knows about foreshadowing, or anyone that knows about psychologic communication and trying to control what you're saying, means you can connect negative words with any positive word if you're talking about something you don't want people to believe. But the positive word of benefits is downgraded with if any, anytime they talked about it. New knowledge has elucidated possible mechanisms, actions of vitamin C. So we didn't even know how it would work before, so we trashed it. But now all of a sudden it looks like there are some therapeutical effects that are biologically plausible. Recent in vitro experiments indicated vitamin C only in pharmacologic concentrations killed cancer cells but not normal cells, and that mechanism was via hydrogen peroxide formation. So there's in vitro data, what we say about in vitro in the lab, that vitamin C only in pharmacologic concentration, so it means it had to be IV, it had to be large doses, killed cancer cells and not normal cells. Now, we've literally had someone, and I quoted it not too long ago, a cancer patient that comes in that's taking vitamin C, goes to their cancer doctor and says, why are you taking that? He goes, well, I think it can help me feel better. And he goes, well, if it makes good cells better, it makes bad cells better too, right? Like, no. The question he asked her was, well, what do you think? If it helps good cells live, what do you think it does to cancer cells? Well, according to this, it kills them. I didn't say that, but this article said that. That was in vitro. Okay, so the next statement, in vivo animal data. At these concentrations, vitamin C slowed tumor growth. Pharmacologic vitamin C concentrations produced in animals by parenteral administration was reproduced in patients in a recent clinical one-phase data, and that was from 2008. Because of new interest in IV vitamin C, again, this paper is published in 2010, right? So that was new. It was just new interest then. 14 years later, we're still not talking about it, right? Our study obtained quantitative information that substantiated all previously anecdotal reports. Despite unexpected wide use, we found side effects of vitamin C were surprisingly few. Findings in this paper will alert conventional practitioners about unrecognized wide use of vitamin C. So they're going to spread the news that there are a lot of quacks out there treating people with vitamins. Here you go. pharmacologic evidence now reveals that exclusively oral vitamin C doses in the Mayo clinical studies produced peak plasma concentrations of only 0.2 millimeters, while the same dose given IV would produce peak plasma concentrations approximately 25 times higher. So it's talking about Linus Pauling study. It says that so soon after its discovery and synthesis in 1932, parenteral vitamin C was shown to significantly decrease poliovirus infections in primates. Sound like a pretty good use of IV vitamin C when polio was a thing. And it goes in and says, oh, by the way, Linus Pauling talked about it for cancer, but in reaction to Linus Pauling and what he wrote, they did a placebo-controlled, double-blinded clinical trial at Mayo that showed no efficacy. Of course, the Mayo study was using oral doses of vitamin C. Here's the one sentence. This is the paper. Recently, a study in mice reported decreased efficacy of cancer chemotherapeutic agents with parenteral use of a metabolite of vitamin C, which is dihydroabsorbic acid. It's important to note dihydroabsorbic acid is not detected in human blood or tissues, and it's not commercially available. So if you really want to tilt the scale in your favor, use something that you know is not going to work, and that's what they did. So that's the only study published that I can find that showed that high doses of vitamin C decreased the chemotherapeutic agents, but it didn't show that high-dose vitamin C does that. It showed that high-dose dihydroabsorbic acid does that, and that's not something I would ever give to someone or recommend. Let's go. I think that's a really cool paper. Annual update on now critical medicine. A lot of the journal articles recently are about clinical medicine updates because guess what happened in critical care? They got saddled with a lot of really sick people in viral load recently that they didn't have anything to treat them when they were in these big acute stages of cytokine storms. I don't know where you heard that word and what illness we might be talking about, but severe outcomes and death from cytokine storm syndrome were treated. That would be novel coronavirus pneumonia, NCP, severe dyspnea, shortness of breath, that's what dyspnea is, acute respiratory distress syndrome, fulminant myocarditis. Who gets myocarditis now? I keep hearing that word a lot. I don't know. A lot of things talk about recent surges in myocarditis. Some medical treatment out there seems to have resulted in some of that. And disseminated intravascular coagulation. Those have been treated effectively with glutathione, relieved the dyspnea in people in cytokine storm. In critical medicine, high-dose vitamin C for limb ischemia and reperfusion injuries, 2018 clinical update. A great review paper on the use of IV vitamin C in adult patients. A big multi-center review published in July of 20. And literally the data is 74 different studies, almost 10,000 patients. The conclusion was no consistent evidence that high-dose vitamin C is more harmful than a placebo in any of the double-blind randomized controlled trials that they reviewed. Sounds like a really important paper. It was published in 2020. Critical care medicine. Their conclusion, no consistent evidence that IV high-dose vitamin C is more harmful than placebo in any of the double-blind randomized controlled trials. So all the stuff you're being told, vitamin C can hurt you, it's not healthy, it just gives you expensive urine, that's not what's in the literature. Another double-blind controlled study showing the safety. My favorite article was a redacted article where the entire article was retracted because what it showed is a significant benefit from high-dose vitamin C in the treatment of sepsis. And they didn't redact it because their statistics were wrong. They redacted it because they didn't talk about the potential complications of vitamin C. And we just know that the papers published since then, this paper was redacted in 2020 in the Irish Journal of Medical Science. But their results were that in sepsis-related organ failure, if you got treated with high-dose vitamin C during the period you had sepsis, which Western medicine doesn't do well with sepsis. A lot of people die of sepsis, which is disseminated intravascular infection. The early treatment of sepsis with intravenous high-dose vitamin C in combination with standard therapy showed a beneficial effect on sepsis in terms of reduced 28-day mortality and a decreased systemic-related organ failure assessment. So they call it a SOFA score, but it stands for sepsis-related organ failure assessment. So it dropped the organ failure in sepsis by more than 50%. So if you get sepsis and organ failure and you die, they could have given you vitamin C and made a big difference in the treatment of that. Everything else is a bunch of papers about using it for coronavirus patients, and I think that that's way more controversial and way stupider to talk about. I think if you have a viral illness, whether it's the flu or the cold, oh, by the way, the cold, we can't treat the cold. Yeah, airborne. You can go to CVS tonight, go through the vitamin section or go and look at cold medicines, and it'll say airborne has the ability to make the claim they cure the cold. And you know what's in airborne? Vitamin C and zinc are the effective ingredients. So, of course, with vitamin C and zinc, you can treat the cold. I think that when you look at viral illnesses and to talk about a narrative against IV therapy is kind of silly. They had all the IV treatment menus here for me to go through and a bunch of things like that. And I didn't want this to be an infomercial for the different IVs that we have available in clinic, because we worked really hard to come up with those formulations, because I want to make it where we can kind of be treatment specific. If you're just looking for a wellness IV, it needs to have enough absorbate in it to matter. You need glutathione pushed before it. You want to get some enzymes regulated. You want Myers cocktail, some B vitamins. There's a lot of ways to wellness, right? But if you have viral infection, if you have a cold and flu, some of the IVs, we're not treating that, but we've named some of the IV treatments to represent kind of more of why we came up with certain formulations when we give you IV therapy. But anytime we give IV therapy, we've interviewed the patient, we've taken your history, we've rolled out a bunch of renal failure. We're treating you in the least of it. Here's opportunity number 2, unless I missed a couple. In the way that has the lowest potential downside and the highest potential benefit, because everything is a value score weighing the potential benefit versus the potential complications, especially when it comes to cost. We're not talking about anything that's abnormally expensive. We're talking about, first of all, just getting a liter of fluid can be incredibly, everyone out there that chases you around with water when you have a headache. Oh my God, are you drinking enough water? I can't tell you. I have one patient, and it's the funniest thing I've ever, he's really funny person. And he says, oh, Lord, don't tell my wife that. She's going to say I'm not drinking enough water. Like, that's her answer to everything. He says, I cannot drink any more water. I can't even sit through a meeting now. She makes me go through all. He goes, I have to get up. So we're laughing about just being hydrated. So apparently a lot of people think that hydration is important. I would not disagree. But the best way to get hydrated is a liter of fluid IV. So at the very least, I know we're not hurting anyone if I'm hydrating you in a way that's much more likely to actually be hydrating than drinking a lot of water. Number 1. Number 2, if there's therapeutic benefit in anything we're talking about, and again, these are 20 or something articles. Each one of these articles referenced hundreds, and my overall data bank search on this, as far as bookmark on vitamin C, I think is now approaching like 300 different articles that I think are crucially relevant and clinically important. And so I can't even narrow that down. Like, I'd like to get down to 10, 15 kind of bellwether. I think there are some bellwether studies, some bellwether scientific articles. In the use of absorbate, I think there are 300 bellwether articles right now. That's what I've been able to limit it down to. So if you can't find any, you're not looking. But I think that we see that Western medicine hasn't been looking in a long time, because there's articles published in 2021 talking about the emerging science. The article in 2010 is talking about relatively new data. The data in the 70s is like, here's what we're finding. So all that to say, we worked really hard to try to come up with the least invasive ways to help you be healthy. I think that there are some pretty easy clinical hacks with IV nutrition. I have personally kind of under-talked this a lot recently until my daughter pointed out that we haven't brought it up in a while, and she's a big fan. Obviously, our family receives significant IV treatment in our clinic. My nurses are great at starting the IV. Matter of fact, I have one daughter I won't start the IV in because she is really deep and she moves too much for me, but she won't move when my nurse does it. But even my 11-year-old, I mean, she watches it go in. She's a big fan. And anytime she gets a viral illness, she gets treated, she gets hydrated, she gets absorbate to help immune support, not treating an illness, but just for the support of your immune function. And my family has done always very well with that. On an anecdotal note, number one, I think that it was important for me to go back through this because I didn't realize how passionate the narrative against it is until you start reading it. And anytime there's a really passionate narrative against something, I found out that usually they're trying to hide something. And it looks like what they're trying to hide is it works. And oh, by the way, it may make you too healthy. It may remove you as a subscriber from the Western medicine paradrome that they've created artificially. And as an antioxidant, and as something that's needed in every cell of the human body, it might be relatively important. So hopefully I was a little bit thought-provoking. Hopefully I underscored how passionate we are about it and how easy of an intervention this should be for people, and why it's not readily available, I don't know. But again, I want to thank everyone for your attention. Hopefully it wasn't too boring. I didn't talk about the science part of this much. I can go down all the oxidative pathways if we wanted. I'm pretty sure that's not what people want. It is part of me wanted to do that just because I think the Western medicine narrative against this is going to be, well, he didn't really know. I can do that. Like maybe we get a chalkboard and I'll go through all the oxidative pathways of how the antioxidants would work and help you get rid of oxidative stress. But I don't think that's probably the most important medicine narrative for today. I want to thank you for your attention. Again, without your support and without your trust, none of this exists. My medical practice is based on the love and support of a lot of our patients. I'm genuinely humbled by that, and I want to thank you. If you enjoyed any of this content, please like the episode, subscribe to our channel, and go to our website at MOABTexas.com. Go to the link of the podcast and try to check out some of the old episodes. In the beginning, I think we did a better job of talking about some of this, but with the passion against, with peptides and cells and everything, there's a lot of little ways we try to integrate to make you better. And hopefully this is one of the easy first steps that a lot of people is way more approachable and easier to understand. Thank you again.